Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order, and I hope this is quite convenient for the continuous study. I hope you will make use of it. Thank you, my dear friends. My dear friends, today we will discuss a very special topic, and this is actually the topic which everybody is waiting. That is scope of Kaumar clinical practice. Now, after completion of the BAMS, maybe after completion of the postgraduate study or PhD study, when you are moving into the community, how we can practice Kaumar clinical practice in the community, and what are the scopes and how we have to go ahead. So this particular presentation, maybe for one or two classes, will going to guide you to some extent that how you can build up your career in the Kaumar clinical practice. Now look into the basics. Pediatric population in India is about 480 millions. Okay, so that is almost more than 1/3 of the total population. And 19% of the total global population is present in India. Among the children, pediatric population, total 19% is only present in India. So one thing is very clear, that pediatrics is a very vital clinical branch. In the present day scenario, if you look into the contemporary medical science, especially the modern medical science, so pediatrics is one of the very important branch because it is one of the vital branch, covers large amount of the people there. But when we talk about Ayurveda pediatrics is unfortunately not gaining the equal importance as far as the clinical practice is concerned. What I mean to say is, Ayurveda is not the vital clinical branch, or Ayurveda pediatrics is not gaining that much of importance when you compare to the modern medical science. There are so many reasons for that. But now we need to introspect why we are not the mainstream, why Ayurveda pediatrics is not in the mainstream of clinical branch, and where we have to improve and where we have to correct ourselves. Now, look into the facts. As an Ayurveda physician, especially Ayurveda Kaumar physician, if I am talking, the first question which comes to our PG scholar is, how can I practice Ayurveda in children? Isn't it? I am a Kaumar PG now, and first question which comes in front of me as soon as I may complete my PG degree, the question is, how can I practice Ayurveda in children? But unfortunately, this question should come in the beginning of the PG. When you get admitted in the PG course of Kaumar on the first day, you have to get this question, how can I practice Ayurveda in children? Unfortunately, now this question is coming to the mind of our PG scholars when they are about to leave the course. So how we think and what we think actually? First of all, what we think is, we don't have a single medicine which brings the fever abruptly like paracetamol. Of course, I hope this question was there in everybody's mind. One of the most common problem when I go outside is fever, maybe because of respiratory tract infection or so many other things. And that fever has to be calmed down. That is the urge of the parents. Parents will be only happy, only believe in you. So if the fever is coming down within a very short period of time, then they consider that you are a good doctor. Now we don't have such a drug like paracetamol which abruptly brings down the fever in a suffering child. Second question which arises to our mind is, we don't have any antibiotics like drugs which effectively control the infection. Yes, infections are very common in this community. Maybe viral, maybe bacterial, parasitic, or whatever may be, anaerobic, aerobic, etc. But our students or we think that we don't have any antibiotics like drug which can effectively control the infection. and subside the problem. Third question which comes to our mind is, we don't have any emergency medication. Yes, modern science has got emergency medication, so they know how to handle the emergency, but we don't have any emergency medicine, so how can I practice? See, I don't have a drug which can very effectively bring down the fever, so how can I practice? I don't have a drug which act like an antibiotic, so how can I practice? Okay, I don't have any emergency medication, so how can I practice? And we don't have rapidly acting painkillers, and we are also not having the rapidly acting painkillers. So when we are not able to reduce the pain, when you are not able to reduce the pain abruptly, which is the main suffering of the child, so how can I practice? And we don't have IV line facility. Emergency, we have to go for IV line medications and all those things. So route of administration is not there. So how can I practice in the community? So there are so many other questions also, but these are the main questions which comes to your mind, or which comes to every PG student's mind when he is thinking about practicing Ayurveda in the community. Now what we should do now? Now the main problem with the Ayurveda people is, maybe including Kaumarvarti and other branches, we actually fail to read the pulse of the community. And we are not changing from time to time, and we are not able to read the pulse of the community. What I mean to say is, there are so many health challenges in this community. So in that sense, if you see a fever, pain, okay, a infection, these are all the age-old problems which is existing in the medical practice. But in the present trend, if you see, there are so many emerging challenges are there, but we fail to understand that particular emerging problems. And we are conventionally stick to a type of practice where we are putting the clinic and a patient will come, he will having the fever, he will have the pain, and we will give some medications and we will earn something. So we are sticking to this conventional or old pattern of medications, but we have to understand the role of the Ayurveda is not limited to these 3 or 4 important symptoms. We have got so many emerging problems, and why can't we concentrate on this emerging problem? For example, non-communicable disorders. We have got malnutrition, we have got obesity, we have got hypertension, and we have got diabetes. So many non-communicable lifestyle related disorders are there where none of the other medical sciences have a satisfactory answer. And why can't you concentrate more on these rather than thinking and get depressing yourself, get frustrated yourself by thinking that I don't have a medication for fever, I don't have a effective medication for pain, I don't have effective medication for the fever. Why you are thinking so? You need to see what is the pulse of the people. People are now desperately in demand of a proper medication for non-communicable disorders. Okay, there are thousands of millions of doctors are there who can able to treat the fever, who can able to reduce the pain, but there are very limited problems. Very limited doctors are there who can give advice to a patient to prevent the non-communicable disorder. So why can't you be such a selective physician? So therefore, what is actually going on the society or community, we are not aware of that. For example, in Kaumarvarti, if you see, childhood developmental problems, learning disabilities, attention deficit problems, autism like problems, okay, psychological problems, concentration problems, these are all the burning problems, and immunity. So why can't you concentrate yourself on only these areas rather than thinking of some of the acute problems? There are so many facilities there for the acute problem. Yes, emergency medication is also there, which is not so effective in Ayurveda, if I want to say. There are medicines for the emergency. Compared to the present day scenario, it may not be so fast acting or so effective, maybe. But there is no answer for all these questions. See, acute problems are only 20%. Chronic problems are 80%. So 80% of the chronic patients are waiting for you. Give me some solution, because there is no problem, there is no solution for the chronic problems in the any other medical sciences. They only give the symptomatic treatment. It may be joint pain, it may be hypertension, it may be diabetes mellitus, everything is symptomatic treatment. There is no a proper treatment protocol for that. Okay? Ultimately, after a disease reaching one particular stage, so their only thing is manage the patient symptomatically. They are all disease managers. Okay? So now, therefore, we need to read the pulse of the community. Identify what people need. From an Ayurveda people don't need that you should treat the fever. Or people don't expect that you should treat the fever. People don't expect that you do some emergency treatment. So what they expect from you is you treat the chronic problems. Therefore, maximum number of the patients which are coming to our Ayurveda is chronic patients, chronic arthritis, chronic diabetes mellitus. We have the chronic cases of hypertension, okay, chronic psychological problems. So people are so intelligent, so they are selecting Ayurveda only for the chronic problems, but we are not knowing that. We are struggling to prepare ourselves for the acute problems, to face the acute problems. So people already decided that to prevent the chronicity of any disease, Ayurveda is best, and we are going to Ayurveda. But we are not ready for that. So inquire what is going on in the society. Acute problems, yes, anybody can treat it. Leave it. 20% patients of acute problems, leave it. Emergency medication, leave it. Concentrate on the chronic problems. Prepare a protocol. A proper protocol which includes the medication, panchakarma, yoga, pranayama, everything. And prepare a protocol for the obesity, protocol for the nutrition problem, protocol for the immunity enhancing methods, protocol for chronic problems, arthritis, whatever may be. So why can't it is possible? It is possible. So problem is, yes, we fail to understand the pulse of the people. We are still thinking in a conventional way. We are otherwise copying the others. Putting a clinic, and we expect some people to come, and we should able to treat all the disorders. It is quite impossible. Concentrate yourself only on only one particular problem or two particular problems. Be the expert of that. Okay? Do repeated research on that. Do trial and error methods on that. Get expertise. People will come to you as an expert of Ayurveda. So we need to change our thinking. What we have to change ourselves, apart from the conventional way of practicing. So that we will discuss in the next class. Thank you.